guys, welcome back to my channel. If you are new to my channel, my name is Lynn. I am an overseas student from Vietnam who had the privilege to live and work in the UK for the last 10 years. I'm now practicing as the pharmacist and work in the UK, and I've used this channel to share with you guys all the learning that I've gathered from my life experience of living in UK, from all the materials that I am interested in life, in investing and in pharmacy. So in this video today, the topic will be about pharmacy. I would like to share with you guys, all trainees pharmacists, the experience that I've gathered when I was revising for the exam, and all these hints and tips had helped me to pass my pre-reg exam first time. Tip number one is that if you haven't done so, please look at GPhC assessment framework, where they would list out the topic that's really important in the exam, and with the enormous amount of information that you need to remember, please make sure that you revise over the topic that really high weighting. So make sure you recap over those syllabus, because it helps you to create a revision checklist. Because the last thing that you want to be is that you spend a lot of time on the topic that's not really relevant, or on the topic that will not be assessed in the exam. So second tips that I've got for you guys will be looking at the feedback from GPhC that they've gathered from the previous exam. Every single year they will upload all of the themes or topics that the student find challenging, and you can find them on the GPhC website. So have read through them, the common themes that I find challenging, and I've realized that not just myself but other students also find it challenging, will be, for example, with maths question. People find the question about rounding quite challenging. When you read through the questions that require rounding, then make sure you think ahead, think practical. Sometimes it's easier to learn than common sense might not be common practice. Some questions require you to round at the beginning, some questions require you to round at the end. So make sure you read through the question properly, and especially with maths question, I strongly suggest you to read through the answer sheet, because that's when you find out which unit your answer will need to be. It gives you the direction of what do you need to do, if it's in millimeter, if it's in centimeter, if it's in capsules, or if it's in one decimal place. Be practical as well. So for example, if I calculate a question and it requires 1.6 capsules, then you know that for every individual dose they would need at least 2 capsules. Then your total quantity supply will be based on 2 capsules each time, in terms with the frequency, time with the duration. Or for example, if they're using ampoules, and if it's single-use ampoules, then and you calculate it as 1.2 ampoules, then you know that each time the nurse will need to have 2 ampoules. Then again, time with frequency and time with the duration of the treatment, then you will calculate the total quantity of supply. There are some unrealistic answers from the previous exam, such as supply an insulin pen for patients to go on holiday, and the answer came at 85 pence. So you could think practically, when is it that you see in a prescription that the patient going on holiday, 4 weeks holiday, and you supply 85 pence? So when you get an answer at the end, look through the answer. Is that answer realistic? Is it a common practice that you do? If you think that the answer is so abnormal, then there must be something wrong. So recap over the step that you've done before and see what could have gone wrong. Or if you think that you have spent so much time on that one single question and the answer that you've got at the end is not really realistic, then move on to the next questions, and then when you have a bit more time, you can go back to it, because you can look back at the question in a fresher mind afterward, and you might have a different direction to get a different answer. Third tips that I've got for you guys will be that reflection that I've got when I was revising for part 2 of the GPhC exam. Again, as I mentioned before, when you read through the assessment framework, you will see that certain topic will be a high weighting one, such as looking at endocrine, looking at cardiovascular, looking at drug with narrow therapeutic index, all the monitoring requirement that related to them, and any recent MHRA warning. The first topic that I have in mind was the warning regarding quinolone, antibiotic, or I think MHI warning regarding the use of steroids. When would they suggest to have tapering dose that required for patient at risk of adrenal crisis? So when you recap over the topic and when you see any recent MHRA warning, be aware of them, that because they are likely to be tested in the exam. The other topic that I find repeatedly used in the exam will be, again, relevant practice for day-to-day pharmacists, will be any recent medicine that switch from POM to P that you were likely to sell them over the counter, such as sildenafil, sumatriptan, any supply of emergency contraception, so on and so forth. They might likely to ask scenarios that the patient are childbearing age, that have past medical history of epilepsy, and they are taking medicine that enzyme inducer, which will affect the pharmacokinetic of emergency contraception. So what suggestion would you have for the patient? What extra warning do you need to give? The scenario that you are likely to encounter once you practice as a pharmacist. And but please remember, the GPhC exam is not a test of recall, it is a test of knowledge. It is a test of when you practice as a pharmacist as day one. So please don't spend too much time recapping the material by just reading and highlighting. You need to make sure you can apply those knowledge into practice, and chances are they will be asking you scenario-based question. They will giving you a topic or a picture of a scenario that you need to use your pharmacy cap to see what conditions you are treating and what's your first approach. Can you manage them as a pharmacist, or you need to refer them to other healthcare professional? Tip number 4 that I've got for you guys is that when you read through a scenario-based question, after you gathering all the information from the question, think for yourself, what indication are you treating, and can you manage the condition in pharmacy as a pharmacist, or you need to refer the patient to other healthcare professional. So an example that I've got will be if the child presented in front of you and they have a symptom of chickenpox, then can you manage them in community pharmacy? Can you give them calamine lotion or Piriton? Or it's a symptom that they presented look like sepsis, which require urgent antibiotic, and you need to refer patient to A&E? Or any red flags that you have identified that you are not going to be able to help them or to treat the patient in the pharmacy, and they should be referred to other healthcare professional. Tip number 5 that I've got for you guys will be, when you recap over the past paper exam or when you look through the textbook questions, make sure you compare it with the assessment framework to see are these topics still relevant into the exam, because you don't want to spend a lot of time to do the questions that no longer being used in the exam. When I was reflecting over my preparation for the GPhC exam, and when I compare it with the other sitting, the learning that all of the assessors that gather from the sitting, there's a lot of knowledge, a lot of information that I wasn't aware of. And again, we're looking at the exam that I was sitting 4 years ago. There's a lot of things that had changed in the last 4 years. There's a lot of topics that I wasn't aware of, such as the supply of medical cannabis on all of the handling requirement or the labeling and safe supply of them. That wasn't mentioned in my exam, but it might be likely to be mentioned in your exam. So recap over them. Or it's a topic like de-prescribing initiatives that wasn't mentioned before, but likely to be mentioned in the exam. If you are using the material or previous mock paper, make sure that you take into consideration that there's a news information that recently been published that the GPhC would like you to know about. So recap over them. It's not just doing past paper, but also look at comparing the past paper topic with the syllabus to see what other gap that haven't been mentioned. Tip number 6 I've got for you guys will be finding out what your learning style. By now you probably have done at least one mock paper under exam conditions and find out what marks you have got from that, and use the result that you have from those mock exam to revise over your revision technique. Are these topics that you have come across before? Can you recall this information in the exam or apply those knowledge in the exam? Are your learning style active or passive? That you need to be able to apply the learning that you have. So if you have spent a lot of time coloring the MEP, coloring the BNF, and you cannot recall those information in the exam, then maybe it's about time to recap over your learning style. Even though you have covered cardiovascular, but you could not apply those into the question that asking about atrial fibrillation, then maybe it's about time to try other techniques, such as I like to have my revision time with my friends, go over and pass paper under exam condition, then at the end we will marking through them together, and if there's certain topic that I know very well, then it give me the opportunity to teach other. And I find that be able to teach other or recall the information actively can help me to reinforce the information much more. I remember the conversation with others, and like I even remember the room that we were in and the discussion that we had much more in my exam than the time when I just sat there silently by myself to sit and read and highlight through the BNF. Other way of revision, such as listening to podcasts, watching Serena speak, or Abraham the pharmacist, listen to the topic that they describe in their YouTube video. Sometimes I just put my headphone on and listen to them on my way to work. I might not constantly listen to them word by words, but you'll be amazed by how much I actually still remember the voice of Serena in my head, recapping over the type 1, type 2 diabetes. You'll be amazed. Your brain is a powerful tool, and it's remember the information so much more than you actually could think. So do not just listen to it when you in the revision time. You just can listen to it any moment on your way to work. Or I'd like to attend the TPPE events regard on the topics that are helpful. I like to attend them as well. It's just a few hours extra of the day. It was an opportunity for me to apply the knowledge that I've gathered to the discussion that I have with other trainees pharmacists or the other experienced pharmacists, to listen to their opinion. It also helped me with my revision that way. For example, when I was attending CPPE events about epilepsy, so there was a lot of scenario-based questions, and I had the opportunity to recap over my revision. Tip number 8 that I've got for you guys will be, when you practice your past paper under exam condition, always trying to have at least 15 minutes spare when you can just go over your answer sheet to make sure that you have transferred your answer correctly. The last thing that you want to do is that you are putting the answer for question 35 into the answer sheet under question 36. When you go through over your answer sheet, make sure the number that you are written is readable, because you will not be marked if you putting the answer that unclear to the examiner, or if you are crossing the option A and B and you mark it in between and it cross over. Tip number 9 that I've got for you guys will be, if you can, book the annual leave a few weeks before the exam, and obviously speak to your employer, speak to your tutor, or plan in advance so that you can have a block period of time before the exam, so that you can just focusing on your revision only, and you don't have to worry about the commute to work and all of the problem that associated with work. You just need to get into your revision zone and just focusing on passing the exam only. Tip number 10, which is the most important tips that I've got for you guys, will be make sure you take care of your body. It's easier said than done. I know when it gets closer to the last month of the exam, all of a sudden you don't have enough time left. You might feel a bit overwhelmed, and taking care of your body will be the last thing that you're thinking, because you just probably thinking about, actually I should really sleep less than I have to gain an extra hour to revise. But actually, please think again, you have been revising throughout the year, and it's not, you are sitting a pre-reg exam, a pharmacy exam, about the knowledge that you not just come across every single day at work. It's not something that you don't know anything about. All the knowledge that you have been gathered through the last 5 years of university. You have done plenty of exam before. by now, this is a time for you to stay well, take care of your body, eat healthy. So I would just say, if you don't want to spend a lot of time cooking, it's okay to get ready meal, but make sure that the takeaway that you eat is a healthy option if you can. I know that when you are revising for the exam, especially during the last period, you might be under enormous amount of stress. Please be mindful that stress can affect your immune system and you are likely to catch other infection easily, and especially with still living in a pandemic time. If you haven't done so, then maybe take some immune boosting vitamins. And please don't forget that when you go into the exam, you are declaring that if you are fit to sit in the exam, you know that some things that might come up on the day that it might alter your performance, then it's okay to declare that you're not fit to sit the exam. If you are appealing at the end after you sit the exam, it might be too late, so because it won't affect. We are given 3 attempts to pass the exam, so you don't want to wait any attempt at all. The other things that I have in terms of looking after body is that you need to learn how to manage stress. I know it's easier said than done, but make sure, I don't know if you do, but I find practice mindfulness meditation really helpful. It helped me regulate my breathing. I like to go into YouTube to listen to a mindfulness meditation video. I know that my friends have tried other apps that are available on the Android or iPhone, such as Calm or Headspace. When you just practice, you just do it every single day. Spend 20 to 30 minutes of your day to relax your body, to help you learn to regulate your breathing. And you might not be realized that when you are under stress, the breathing techniques might not be correct and you might not have enough oxygen to go into your brain. You know, when I know that I am under pressure and I know that I get a bit hyperventilated, my breathing get a bit too fast, and I just sit, and instead of having a deep breathing, just do regular breathing, counting 1, 2, 3, 4 in, and hold your breath 1, 2, 3, 4 seconds, and exhales 1, 2, 3, 4 out. And I find if I just keep repeating that step for 20 minutes to 30 minutes a day, I feel much calmer, and it helped me to think more clearly. And I know that if you like walking, and the weather is, because the weather is really nice now, if you can just go a little walk in the forest, or at the weekend when you can go and relax your mind, absorb that calmness from the nature, and it's helped you to think much more clearly. And you'll be surprised, when you are relaxing, your conscious brain might be switched off, but your subconscious brain is still processing through the information. So it's really important that you have enough sleep, and your brain, the amazing brain, is still processing those information in your sleep anyway, to restore those information into your long-term memory. Switch off at the end of the day. Stay away from your phone, stay away from all the notification if you can. This is time for you to be selfish, and you can be selfish right now, because this is the critical time. I know it might sound autonomous, just eat, sleep, pharmacist, and repeat, but this is time for you to be selfish and just focusing on your revision and passing the exam only. Everything else can be put on hold for now. You can catch up with all the gossip, catch up with all the Netflix series later on when you complete the exam, and your friends and your family will understand that this is everything that you ever wanted, and you just need to focus on them only. So that was all of the learnings from my experience or my reflection that I've got when I was revising for the GPhC exam. I hope you find them useful. Have faith in yourself, be confident. You have come so far, you've done many exams before. Look at it in another perspective, that you have worked really hard to where you are today. You deserve to have your name under the pharmacy register as much as everybody else. You do not need to compare yourself with anybody. You just focusing on your revision plan and use them and plan them strategically, especially the crucial point now as a month and a half left before the exam. This is a reflection that I have in my memory. I hope you find them useful. If you have learned even just one thing from my video, why not like and subscribe to my channel? I wish you all the best of luck, and I look forward to see you again in the next video. Take care and all the best. Bye bye.